I mean, even ACOG says, and this shows how powerless they are really, it says, absolutely don't induce anybody till 39 weeks. Well, nobody's listening to them. But even that I have arguments with. I mean, as a lot of the inter-hospital group and others have shown, the only safe thing to do is to wait till the mom goes into labor and let her have a good trial of labor, and as long as the baby's okay, you know, if some terrible obstruction occurs, then do a cesarean. But yeah, I mean, it's obvious from this huge increase in prematurity that the dates are wrong. Right. And then a lot of docs will say, well, I know we did that ultrasound at 18 weeks and said that your due date's June 12th, but we just did an ultrasound in the office and you've got about a month to go by that, but it looks like you're really a couple weeks ahead of that. That's worthless. Ultrasounds at that time in pregnancy are just worthless. They're really worthless at guessing weight.
Yes.
And I mean, that's always hard, but so, okay, well, as you think about it, if you think anything should be added, or and if you're a member of KIMS, well, you will be involved in looking at all these things before they hit the streets. So we'll try to get all these done before the end of the year.
Now, realistically, how many doctors do you think would be using these?
I think if, let me get to that, okay? No, that's an excellent question. And that gets me, it's like I planted her in the audience. Yeah.
I think to an extent, in a way, that's where like a birth network comes in too, and where Juba's coming, like, you know, yes, it would be great if it was a standard of care and physicians or midwives had these in the charts, but until that happens, then it happens in this level, you know.
Okay. Yeah, oh no, that's why it's so exciting. I mean, I haven't seen groups like this getting better together since back in the 60s and 70s, when there really was a grassroots movement, and it has to be, because the doctors won't change their behavior unless, I mean, that's why, you know, it's easy to talk people into going along with this, but if the patients really understand what's going on, and they know that they can get their information from the KIMS website and not from their doctor's office, they can change doctors. But what we found, I was on the ICEA board in the late 70s, and that was a real grassroots movement of women to, you know, back then fathers couldn't be in the labor room or in the delivery room, anywhere in the country. And so we started that up at Gainesville at Shands in the middle 70s. And people came from Georgia and all over Florida, and they'd stay in motels so the father could be with them. I mean, that's how crazy it was. Well, now we've entered another era of craziness. It's just different, you know. But it is going to take women and husbands and significant others to make this happen. And I'll get into some ways now, because now we're talking about action here, okay? Here's what some of the things you can do. For one thing, we're really, have any of you been on the website on Push for Midwives? Well, one of the things you're arguing with we have a tremendous opportunity here now. All of our outcomes are going to hell. Cesarean is the #1 operation in American hospitals. It costs billions and billions of dollars. We need to save money to pay for President Obama's health care plan, and what better way to start than right here. So we have a tremendous opportunity right now in the world's history to do something. If we miss it, we'll probably never have another chance. First place, if doctors don't want to work nights and weekends, why should they be the primary care providers for pregnant women? Isn't it a great time to go for, which is something we've been pushing for years, and with the Frontier Nursing Service and so on, one of the oldest midwifery services in the country, why shouldn't midwives be the primary care people? And how do you make that happen? Well, we're going to have to set standards for care at the national level and at the state level, and those standards will be the ones by which you get paid. And if you don't follow the standards, you don't get paid. Now, the doctors will yell, "This is cookbook medicine. It takes away the art of medicine." Oh, hi, Mary. There's Dr. O'Mara, obstetrician from Tampa. No, that shut him up. No, she runs a big, wonderful midwifery service in Tampa. See, I didn't even know she was standing there when I said that. So we're going to have to set standards, and one of the ways we'll convince the regulators to set standards is that everything's out of control now. It's Dodge City. We've talked to Blue Cross Blue Shield and others about the high cesarean rate, and they said, if the doctors decided it needed to be done, we're going to pay for it. And we'll just raise your rates next year because it's going to cost more. So standards are very important, and even though they may sound like cookbook, we could use a little cookbook. Saying, no, you don't take a normal woman and go straight to a cesarean for her. We're not going to pay you for that. And that'll turn things around pretty quickly, because it is pretty money driven. And one of the ideas is to reform the way we pay people. And right now, basically in most insurance companies and with state Medicaid, which is half of our births, you get paid about the same amount for doing a cesarean as you do for a vaginal birth. We changed that about 15 years ago. Didn't make a whole lot of difference. Why not? What's the incentive, the cost, the financial incentive for doing a cesarean? Time. Time is money. It takes a half hour to do a cesarean, and you may be stuck in there for 4 or 5 hours waiting for somebody to give birth vaginally. So one idea is, and this is just a for instance, is to pay $2,000 for a VBAC, and this would be the doctor payment, $1,800 for a vaginal birth, and $1,000 for a C-section. But it's the time, not necessarily the money, that makes the biggest difference. The next thing is about, the docs will say, well, it's the malpractice thing. And I already talked a little bit about that. And if we have state standards of care that regulate payment, then that's a help if doctors and midwives get taken to court. Because as long as they were following the standards, it gets pretty hard for a lawyer to say something was done wrong. And we don't have that now. So lawyers can bring in any crazy person, and ask them to say, oh, the doctor should have done a cesarean. And maybe the doctor did everything right. But, the jury sees the child with cerebral palsy and sees the rich insurance company and doesn't think about the fact that when they give that family $5 million, which maybe they deserve, maybe they don't, that their own rates are going to go up the next day. And so setting standards of care that people follow, I think, will really help with the malpractice thing. The other thing, as I said, we need to educate the public. I hope all of you are familiar with Ricky Lake's movie, Business is Being Born, and they're now doing webisodes with celebrities. And I think that's wonderful because, Britney Spears and those folks that schedule their cesareans get lots of press, but it's really neat that other celebrities that people respect are getting out there and saying, this was one of the most wonderful things of my life, and I really think we ought to do that.